To move to this story, the Anti-GBV Violence and Femicide Assembly at the University of Cape Town is taking place today. It is addressing challenges and needs faced by students across all ages, races, sexual orientations and gender identities, and specific groups such as persons living with disabilities, migrant women and trans bodies impacted by the scourge of gender-based violence. It is also being held in memory of Uyinene Mrwetyana. She was a student at the University of Cape Town at the time of her murder on the 24th of August 2019 in the Claremont. SABC News reporter Atule Joka is now joining us for an update. Atule, good morning. Thank you so much for making time for us. Speak to us about some of the focus areas of the conversations that will be taking place today, and also considering that there was a summit that happened last week actually in Boksburg, where Higher Health was trying to deal with this issue of gender-based violence and also what they call the mentalities of men when it comes to social ills.
Indeed, Aldrin, various stakeholders will converge inside the hall here. We have about 26 universities and 50 TVET colleges that will have its students to come here to deliberate on all these issues that are affecting people and also even the students in the higher education sector. Aldrin, you remember just last month on the 24th of August marked exactly 4 years since the death of Uyinene Mrwetyana, who was murdered at a post office here in Claremont when he went to collect her parcel, and then she passed away at the hands of the perpetrator after she was raped as well and murdered, and her body was also found near Kayelicha. That was a gruesome murder that took place at the time. So they will be commemorating and marking that particular event to see what are some of the gains that have been made since then. As you would know, that there was a huge uproar after the death of Uyinene. Most people coming through. It was the birth of the initiatives such as the Me Too campaigns, various people coming forward with their stories of GBV, which put a spotlight on gender-based violence and attacks on women in this country. But I do have Professor Ramnik Aluwalila. I will ask him about the question that you posed earlier as well, Aldrin, of Higher Health. Say, just talk to us more about this event, some of the stakeholders that are here and the focus area that you want to touch on here today.
No, thank you very much. Today is a reminder of a brutal reality that higher education or post-school education or the entire country faces, which is gender-based violence. I mean, if 10% of the total reported cases in this entire country comes from higher education, then we have a problem. What we are doing today is to commemorate Uyinene. A reminder what we need to do as a sector. And what we have gathered here at UCT is bringing entire universities system in the Western Cape, our TVET colleges, our community colleges together to have an honest dialogue with them of what we are, where we are as a sector. We have a policy since Uyinene's death which has been now released and launched, a policy that guides us investments, KPAs to our institutions around how to deal with gender-based violence. And I think it's an important step. It's a document, of course, endorsed by the cabinet of this country, but a document that now forces institutions to put infrastructure, campus safety audits, residence protection, drugs and alcohol and the limitations of that, because 65% of GBV in post-school education is preceded by drugs and alcohol. So we need to tackle the causes, gender equality, issues of patriarchy, transforming mentality, how do men dialogues happen. So where are we as a sector? If a young woman gets sexually violated on our campus, what is her journey from there? I mean, how does the institution react to it? Is there a disciplinary tribunals that take precedence towards making decisions? Non-biased of management, civil society supported, student supported, gender supported tribunals, and that's what the policy now governs its establishment. Comfort rooms, psychosocial assistance, linkages to South African Police Service, making sure that the evidence is preserved so that if we do not give justice to the people for such brutality, then the reality is people will not come out and tell us how many cases of GBV do exist in the system. So I think that's all we're going to be engaging today, and we're going to go deeper into this.
I see you want those who are perpetrating such acts to be held accountable. But let us also zoom into the causative factors. My colleague was talking about the gathering that you had in Boksburg some time back. You also picked up that men, their mentality is also quite a problem. What have you picked up from there, and also how are you planning to, what are some of the solutions that came out of that?
Absolutely. I mean, if you look at the reasons of gender-based violence, if you have to solve a pandemic, it's a pandemic, it's a disease. It's spreading around the entire country. If you are solving a pandemic, then you have to find the cause. And one of the biggest causes, if you look at cases of judicial, if you look at people who are perpetrators and been in the correctional services, or even from the data that's coming in, men have been the reason. Men are one of the biggest reasons of perpetrator. So we are asking transforming mentality, which means men needs to transform. So if they are a problem, then they need to be finding a solution with us. They should also be the reason of a solution into how we resolve gender-based violence. So definitely, transforming mentality is one of the biggest programs. We have launched it last week under our minister. We are going to go serious. It calls for action for men peer educators to come out, engage other men. It comes out, call for action towards establishment of co-curriculums on transforming mentality so that men are taught about disciplines and behavior. It talks about drugs and alcohol culture, which we have also related a lot with men and men parties around, which causes a huge influx to gender-based violence. And a lot of call for action on men dialogues, that there has to be frequent men dialogues. Peer is a solution to transforming mentalities.
One of the arguments that normally comes is that the men who normally perpetrate these actual acts are not part of these discussions. We do have these dialogues, but the actual people that are supposed to be taught and transformed are not actually here so that they can get...
I'm proud of one part now, in last 3 years, since we've started establishing a number of peer educators in the entire post-school education. I'm going to keep a context with Bizana, where one of our TVET colleges. I'm going to talk about Alex, TVET campuses are. I'm going to talk about a Walter Sisulu University, which has a Queenstown campuses. So I'm going to take a context of rural, because urbanized social media makes gender-based violence known. But this happens in every center, every complex, every rural or informal settlement. So most of the men who are now coming to become peer educators are men who either have seen perpetrators in their own families, who've seen their mothers, who've seen their sisters suffering, and they are a good reason to talk about. But we also have now started seeing transforming perpetrators. We coined a new terminology called transforming perpetrators. Means perpetrators who were men who did this and now are acknowledging that they did it. And I think that's very important, because we might be doing in our isolation and not admitting that we are doing, because in a partner, as a partner violence, we are creating partner violence, but listening to a peer and saying, okay, we need to reflect back that we are in the same problem. So I think that movement is very critical. So transforming perpetrators are a very important concept that we are moving into. We want more people who have now the insight to go and tell others that they have made a mistake, correct others who are making the mistake. To inform. The only way is peer-to-peer. We need to bring peers together.
You said about 24% of gender-based violence and femicide issues are okay in higher learning institutions. Because is that it seems to be a higher number. Learning institutions should be safer. What's the percentage, and also what seems to cause that?
So the MRC and the higher health studies shows 10%. 10% of the total reported cases. But we also know that only 1 in 10 people in South Africa report. So the reality is far different from what the data can suggest. But it's still a very high number. Uyinene's death is a brutal reminder of many more that happens. But because of systems and things changing now, with the help of curriculums being introduced, co-curriculums, dialogues, peer-to-peer program, for the first time we saw 5,000 young women in the last 2 years coming out to higher health and opening up on their gender-based violence. From few hundreds who were reporting, it has gone to thousands. And not thousands or 5,000. It's a big number for us. We are very proud of that number because these young women who are suffering have opened out. In any case, like Nosikelo's case in University of Fort Hare, where there was a partner violence which led to brutality of killing, if at early stages of a partner violence, if we can intervene, if they open out, counseling can be brought together, relationship counseling can come together, or we can remove the trigger of that violence so that it doesn't lead to death or the violence to the level that we have seen, this can save lives. So early interventions, early risk screenings, early people reporting does have a huge bearing towards saving lives. And that's where we are going to go towards.
You mentioned that it's quite rife in rural areas, in those institutions there. I've heard stories about what is happening also in Bizana institutions as well. Talk to us about, just bring light to what is happening there.
I agree with you. This is not a UCT problem. This is a problem. It happens everywhere. In fact, it happens a lot in the rural and the informal settlements. Maybe social media is not too good there. People are still in the rural. You know, the challenge in South Africa is if a young woman gets violated, because the mother has experienced, she will say suppress it, because that's how it's tabooed into the system, and it becomes more tabooed when it comes to rural areas and informal settlements. So I think the program intensification in places in Ulundi, in places which is like in Guguletu, in Umlazi, where Mangasutu University is quite important, and we have to keep pressing it that the reality has to be balanced for the entire nation, and probably more in the rural areas where the stigma of such issues to be spoken or reported is more higher than in the urbanized setting where there's more peer influence and chances of reporting. So you're right. It's not just Bizana. If you come to my office, I'll share with you, it is every corner of this country, and probably globally.
Before I let you go, any message that you will be driving through here today?
Yes. The policy is a statement. Yes, it's an important decision, but the 9 protocols that we have released, campus safety audits, campus protection through lighting, from library to residences to home, that saves life, bathroom latches if they are locked or not, where rape can happen, sexual violations can happen, residence protection, private accommodation protection, community patrolling, community policing, which means police and our community joining hands, reporting, evidence recording, disciplinary tribunals, everything that revolves around protecting a human life in our campuses needs to be discussed today, and that's the message we're going to be going for.
Thank you so much. Anything that can be done to protect a human life, this is what they will be driving through with this particular conversation, Aldrin. That was Prof. Ramnik Alwalila, CEO of Higher Health, as they are coming together here with different universities, 26 of them, and 50 TVET colleges, coming together to try and find solutions and interventions to try and curb the higher gender-based violence, which has engulfed the country. We know that South Africa is amongst the highest countries with the highest rates of gender-based violence and femicide, which is the killing of women and children, Aldrin.
Thank you so much there, Atule Joka, on a very important event also taking place there.